Hey guys, welcome back to Film Title. Today we'll talk about the most nauseating moments on Dr. Pimple Popper. Let's head into it. Number 1. Scrambled eggs lipoma. From creme brulee to mashed potatoes, Dr. Pimple Popper likens her patients' lumps and blemishes to food. The famous dermatologist did precisely that with the man's excellent cheek lipoma in a YouTube video posted this week. Lipomas are fat-filled growths that appear between the muscle and skin layers of a person. Lipomas usually grow slowly and are modest, with a diameter of around 2 inches. When pushed with a finger, these growths normally feel doughy and move around a little under the skin. Lipomas are painless for most people, but they can be uncomfortable for others if they're near nerves or blood vessels. The lipomas can be drained if this is the case. People are more likely to develop lipomas as they become older, mainly between the ages 40 and 60. Doctors aren't sure what causes lipomas in the first place, but they suspect that some people are predisposed to them genetically. Dr. P explained to the man that another doctor had attempted to remove the growth previously, but had failed to do so completely. Lee began the treatment by numbing the area before cutting into the lipoma center with a blade. She next zapped tiny blood vessels in the incision with a cauterizing pen to prevent excessive bleeding. Dr. P next used scissors to snip away at fibers beneath the skin, making it simpler to detect and retrieve the lipoma. She squeezed the skin around the growth with one hand, while using the other to tweeze the lipoma with tweezers. Lee decided to chop out tiny parts of the lipoma after a few minutes of shimmying it about the inside of the cavity. According to Lee, eliminating the growth bit by bit was a preferable method because it was deep beneath the man's skin. Each cut lipoma chunk looked like a piece of scrambled egg. Dr. Pimple Popper used stitches to suture the cut on the man's face after double checking that he had removed the entire lipoma. Number 2. Fossilized rock chest cysts. Dr. P reconnected with an old patient, removing a new cyst that had formed on his chest since their first encounter 6 months ago. Dr. Pimple Popper detailed the surgery in a March 5 YouTube video. The patient initially sought treatment from the celebrity dermatologist for dozens of steatocystomas that had developed on his face, neck, and scalp. Steatocystomas are little raised bumps that contain oil and fat from skin glands. On the chest, upper arms, and face, they usually appear in clusters. Genetic alterations, according to experts, are the cause of the non-cancerous growths. Dr. P was able to visit him for another skin ailment, a chest cyst, after dedicating an 8-part video series to the patient, in which she dubbed his tiny lump Skittles. Lee began by making an incision on the top of the cyst and widening the opening with her scissors. After numbing the region, she did this. She next felt both sides of the incision with her fingertips to obtain a better picture of how big the cyst was. Skin cysts can occur for 2 causes. Some arise when skin cells burrow beneath the skin and multiply, forming a sac filled with keratin, a yellow liquid-like substance. A cyst can also form when skin glands release oil, which gets trapped beneath the skin and creates a thick, cheese-like substance. Dr. P informed the patient it looks like a small fossilized rock, and that she was mentally preparing for the pop she was going to do. Lee stated that the incision felt strong, as she began to apply pressure on the outside of it. The growth then ejected a white crumbly material. With her tweezers, Dr. Pimple Popper gripped the cyst's mass and cut it away from the inside of the patient's skin with her scissors. Dr. P termed it lovely, and his girlfriend remarked it looked like a seashell. Lee finished the treatment by stopping the bleeding with a cauterizing pen and closing the incision with stitches. Number 3. Stacy. She claims that the cost of removing her growth has kept her from having it removed. Instead, she dresses in extra-large shirts with long sleeves to conceal her baby belly. Stacy also stated that her pregnancy limits her from being as hands-on with her kindergarten students as she would like. Lipomas are fat-filled growths that appear between the muscle and skin layers of a person. They grow slowly and are small, measuring approximately 2 inches in diameter. When pushed with a finger, these growths normally feel doughy and move around a little bit under the skin. Lipomas are painless for most individuals, but they can be uncomfortable for certain people if they're near nerves or blood vessels. The lipomas can be drained if this is the case. Stacy's lipoma felt hard and fibrous on the outside, according to Dr. P, which could make it more difficult to remove in one piece. Lee used an injectable numbing medication to numb the area before using a blade to cut into the lipoma center. A sticky off-white fat mass lay beneath the incision surface, which Dr. P's assistant described as promising. This brings us to the end of our video. I hope you enjoyed it. Hit like if you did, and don't forget to subscribe to our channel so that you don't miss any of our videos in the future. Also, watch the 2 videos that are on your screen because I'm sure you'll love them. With that, I'll see you in the next video.